Every year, the U.S. News and World Report ranking published the best hospital based on specialty, and the relationship between the ranking in these hospital with the outcome of high-risk surgery, such as pancreatic surgery, esophagectomy, and gastrectomy, kind of remains unclear. So that was the real reason why we did this study. We use a Vizient database, which is a database of academic center. There are approximately 650 academic center or their affiliates in the U.S. This is a very robust and comprehensive database, and we were able to identify institutions that were listed among the ranking, and the remaining were not in the ranking. These were evaluated. So we compare ranked hospital versus non-ranked hospital. This is for the specialty of GI and GI surgery. So again, we evaluated 3 operations: removal of the pancreas, removal of the esophagus, and removal of the stomach. And the reason we picked these 3 are these are more uncommon procedure being performed, and they're considered high risk GI procedure. So that's why we picked those operations, and we specifically only picked them for a malignancy diagnosis. So meaning if you remove these, organs for a non-cancer related, it's not included in this analysis. So the main finding was that the interesting thing is that almost half of the operation were done by the top ranked hospital, which in this study, there were 42 of them. Top ranked hospital doesn't necessarily have to be academic center. They could be community hospital. So that's why there were only 2 hospital that were considered top ranked. Volume is huge for complex cases. This is all the operation I kind of stated. This is not something that you would like to go to a surgeon that perform one of these operations per year. This is not it. Maybe an inguinal hernia or going operate on a gallbladder surgery, that is completely different than what we're talking about. The operation that I kind of stated. These are complex operations that have much higher risk of mortality, whereby you want to go to a hospital that does a lot of these operations. For the patient, I think you need to talk to your physician with regarding to management of your complex condition and where to go. So I think it's a collaborative decision between the patient and their physician when you encounter to have these type of complex condition. And I think one of the resources that you can use is the U.S. News and World Report.